Welcome to this evening's semi-final debate. My name is Tiffany Zhu and I am the chairman of this debate. The timekeeper is Helen Manning Bennett. The debate will be judged by a panel of 3 adjudicators who are Mr. Morton, Miss Chow and Miss Van Fripp. The topic for tonight's debate is that doctors should not tell patients who have low-risk condition that they have cancer. The affirmative team seated to my right is from St. Peter's Girls' School. The negative team seated to my left is from Adelaide High School. The speaking time for this debate is 5 minutes. A single warning bell will sound at 1 minute before the speaking time, and a double bell will sound at the speaking time. Please ensure that your mobile phones are switched off. I now declare this debate open and call upon the first affirmative speaker, Sarah Peake.
Good evening, Madam Chairman, ladies and gentlemen. The topic for tonight's debate is that doctors should not tell patients with low-risk conditions that they have cancer. We, the affirmative team, strongly believe that this statement is true. We define the topic as should not tell patients as informing the patients of their condition without explicitly using the word cancer, low-risk conditions, meaning tumours that are small and pose little to no danger to the patients, and cancer as a disease involving the abnormal growth of cells. Therefore, we overall define the topic as doctors should inform patients of their condition without using the word cancer in the circumstance that the cancer is extremely unlikely to harm the patient, and we believe that this statement is true. Today, as first speaker, I will be talking to you about the negative psychological impacts of the cancer label for low-risk conditions, as well as the fact that the word cancer is not adequate in describing the multiple stages and types of cancer, and will propose a solution that does not use this anxiety-inducing word. Our second speaker will be talking about the possibility of people receiving unnecessary treatment or an unnecessary degree of treatment for the form of cancer they have developed, along with the economic impacts of this. Our third speaker will rebut and sum up our team's case. My first point is that using the word cancer may induce extreme amounts of stress due to its extreme connotations and associations with terminal illnesses. According to a recent study on the public perceptions of cancer by doctors Catherine Robb, Alice Simon, Anne Miles and Jane Wardle, the immediate reaction to the news of cancer by all 30 participants whom had never been diagnosed with cancer was, quoted, identified fear, trauma or death, which, the doctors reflected, was an extreme reaction given the declining death rates from cancer, improved treatments, and the many survivors alive today. They concluded that the public image of cancer far exceeds the actual consequences of the disease, given the often treatable, or at least manageable, nature of cancer within the current developed world. Therefore, patients with low-risk conditions for whom no surgery or medical treatment are necessary should not be informed of their condition with the use of the word cancer, as this will bring about greater psychological stress than necessary. Removing the cancer label from low-risk conditions would not be changing the information given to patients about their disease, but rather would allow them to receive this news in the best possible headspace. My second point is that the word cancer is inadequate to describe the multiple forms and stages of the disease. According to the American National Cancer Institute, there are over 180 different types of cancer, all with their own stages. These different cancers can affect different parts of the body, from the blood to the brain. However, even within these types of cancer, there are various types. For example, within leukemia, which is cancer of the blood, there is acute myeloid leukemia, chronic myeloid leukemia, acute lymphocytic leukemia, and chronic lymphocytic leukemia, all of which affect the body in different ways, according to cancer.org. The similarity between these cancers is that the fact that they are all a result of an abnormal cell growth. Despite their common ground, the fact remains that there are so many different forms of cancer that exist that due to the public's perception of the word cancer, as outlined in my first point, it is hardly suitable that this word is used in every scenario when diagnosing patients with low-risk cancer. Instead of using cancer, the condition could be relabeled, eliminating the negative psychological impacts of this word. utilising the example provided in an ABC News report about the subject. If Michael Shirley, 79, was not diagnosed with prostate cancer, but instead told he had an carcinoma of the prostate, which is an abnormal growth of cells within the prostate, it would have reduced his stress. Mr. Shirley has said that it was a terrifying experience. I'd never had the word cancer applied to me. It stopped me thinking, further demonstrating the effect this word has. Low-risk conditions, such as low-risk prostate cancer and stage 0 breast cancer, could be relabelled, a solution which has been proven effective in examples such as a subtype papillary thyroid condition, which has been renamed from a cancer to a malignancy for this reason. So, Madam Chairman, ladies and gentlemen, we, the affirmative team, strongly believe that the statement that doctors should not tell patients with low-risk conditions that they have cancer is true, as not using the word cancer will reduce the patient's stress, is not suitable to describe the plethora of diseases that are classified as cancer, and conditions can be described without the use of this word. Thank you.
I call upon the first negative speaker, Byron Ashwood Smith.
Good evening, Madam Chairman, ladies and gentlemen. The topic for tonight's debate is that doctors should not tell patients who have low-risk conditions that they have cancer. We disagree with the affirmative team's definition. We define low-risk cancer as malignant tumours that are slow-growing and don't require immediate medical intervention. We define patients as cancer sufferers of all ages. We interpret the topic as doctors should censor the word cancer and omit information that alludes to it from low-risk diagnoses. Today's first speaker, I will be talking to you about why patients are entitled to the full truth of their diagnosis. Our second speaker will discuss the dangerous effects of not knowing of the diagnosis, and finally our third speaker will rebut and sum up our team case. The first affirmative speaker has stated that not telling patients of their condition could save them, that telling patients of not telling their patients of their condition could save them from stressing. However, the patient shouldn't have to worry, as the doctor would disclose that the cancer is low risk. Also, the doctors can help address any misconceptions regarding cancer and give the patient peace of mind. Also, any residual psychological effects can be treated by psychologists and therapy. She also went on to state that cancer should not be used to describe low-risk conditions, as there are multiple forms. This is wrong because cancer is a blanket term used to describe all of these conditions, and therefore the label is necessary and is suitable to describe low-risk conditions. Changing the name would give the impression that despite fundamentally being cancers, certain conditions were different entirely. Conditions are described as more than simply cancer to achieve the level of detail, whilst ensuring the nature of the illness, regardless of the severity, is clear. My first argument is that patients are legally entitled to the awareness of the medical condition, despite its potential effect on their mental health. According to the Australian Charter of Healthcare, patients are entitled to make informed choices regarding their treatment, and that they must receive open, timely, and appropriate communication. If doctors were to withhold information such as a cancer diagnosis, they would be intentionally breaking the key medical right of patients, including open communication. Dr. Nespelin, President of the Royal Australian College of General Practitioners, has stated that not calling them cancers takes us back to those days where we're not telling patients of their problems because we don't want to scare them. However, these days are long gone, and therefore patients deserve to know of their diagnosis. If a doctor were to make the erroneous decision to withhold a diagnosis for the patient, they would be impinging upon the patient's autonomy and medical rights. According to the US National Library of Medicine, in an Ontario court case, a doctor was found negligent after failing to warn a woman of her medical diagnosis, even though she had depression. Despite her mental illness, the woman still wanted to know of her medical diagnosis. This proves that if doctors were to withhold diagnoses of low-risk cancer to spare a patient's mental well-being, they may be charged with medical malpractice, proving that a patient's right to be informed takes precedence over a doctor's exercise of discretion. Therefore, patients must know they have low-risk cancer. Now onto my second point. Changing the name of something or withholding information from a patient leads to a lack of trust between the doctor and patient. Trust refers to the patient's expectation of the doctor to do good and be competent regarding treatment. To continue, patients should know of their diagnosis. It is their body, so therefore they should know. Doctors would be abusing their power by withholding information that could potentially benefit the patient. An informed patient can be involved with their own treatment, and oftentimes withholding information from someone who is vulnerable would impede upon their medical care and impede their progression towards their ultimate goal of recovery. A study done by the General Hospital of Psychiatry of 119 cancer sufferers revealed that those patients who felt that they couldn't trust their doctors were more distressed and suffered from increased cancer-related disabilities. This proves that withholding the truth of a diagnosis would not only place a patient's health in the hands of someone who wasn't truthful, but would negatively affect their health as well. Patients with a cancer diagnosis, like any other patient, expect the physician to act within their interests. According to a survey published by the University of Washington School of Medicine, 90% of patients surveyed said they wanted to be told of a diagnosis of cancer. Given that it is generally within a competent patient's best interest to know of their diagnosis, as this survey indicates, doctors failing to do so would further erode the trust between them and their patient. To preserve this trust, the cancer label must not be dropped from low-risk cases. So, Madam Chairman, ladies and gentlemen, censoring the word cancer from low-risk conditions would be deceiving patients and impinge upon their rights. Therefore, doctors should tell patients with low-risk conditions they have cancer. Thank you.
I call upon the second affirmative speaker, Portia Mersh.
Good evening, Madam Chairman, ladies and gentlemen. The topic for tonight's debate is that doctors should not tell patients who have low-risk conditions that they have cancer. We, the affirmative team, believe that this statement is true. Before I begin addressing my points, I would like to point out some flaws in the opposition's argument. Firstly, I would like to bring us back to our definition. We disagree with the definition given by the negative team and would like to reiterate that we are not suggesting that patients should not be informed about their condition, but instead avoid using the word cancer when informing patients with low-risk conditions about their condition. The first speaker has tried to tell you that the patients need and have the right to be told the whole truth on their condition. But ladies and gentlemen, we aren't not telling the patients about their condition. We are primarily just avoiding using the word cancer when diagnosing them. He also tried to tell you that this can create distress and distrust. However, as they are still fully informed, this is incorrect. If removing the term cancer and rebelling this disease would decrease stress, as the term cancer is associated with far worse conditions than this actually is. He has also gone on to tell you that doctors will not tell patients of their condition if they do not use the term cancer, which leads to a lack of trust. However, cancer is only a blanket term which will still be told all information regarding their diagnosis and giving the scientific term. The only thing withheld is the term cancer, meaning that patients will still fully understand their disease. Today, as first speaker, I'll be talking to you about how unnecessary and costly treatment may be undertaken as a result of the anxiety felt by the patient receiving their doctor's diagnosis. I will also be discussing the economic disadvantages many patients may face and how this decreases other people's accessibility to the same treatment. Firstly, we believe that there is no need to tell patients with low-risk conditions that they have cancer, as it ultimately would increase their anxiety, possibly leading them to undertake costly and unnecessary treatment. CancerResearch.com states that it is extremely likely for patients who have been told they are diagnosed with cancer to panic and invest in unnecessary treatment as soon as possible. Patients will naturally seek doctor advice in undertaking treatment that will decrease cancerous tumours, an unnecessary precaution for those low-impacting conditions, which instead will increase their anxiety levels and impact their mental health. The treatments often sought out, such as radiotherapy, chemotherapy, and surgery, are only needed for more serious conditions, not the low-grade conditions mentioned by our first speaker. This is because these treatments have major side effects, such as hair loss, fatigue, nausea and vomiting, and oppressive pain, according to cancer.gov. Cancer treatment is a painful and extensive process for the cancer patient, where they may be forced to quit jobs and spend less time with their friends and family. For patients with low-grade cancerous conditions, this process is highly unnecessary and fertile. My second point is that by telling patients who have low-risk conditions that they have cancer, they are likely to invest money towards treatment and checkups that are otherwise entirely unnecessary and instead could be used by individuals with a greater need for treatment. As stated by cancer.org, the cost of treating cancer can raise up to thousands of dollars, although through over-treatment, and this is not including the required treatments that may be needed as a result of side effects. If doctors continue to inform patients suffering from low-risk conditions using the cancer label, we are ultimately decreasing financially of so many Australians as well as decreasing the amount of treatment resources available for those who really need it. Additionally, patients who undergo unnecessary treatment will most likely experience side effects that require extensive recovery and management to repair the damage, which would add to the growing expense of unnecessary treatment. With our increasing population, there is a pressure on doctors to supply treatment and medication at a fast pace. If doctors are telling patients they have cancer when the condition is only low risk, and therefore unharmful, there will be an increase in the demand for unnecessary treatment, which in turn increases the pressure on doctors to treat patients. At the rapid rate our population is increasing, telling these patients will only put massive risk upon the availability and convenience of receiving treatment, especially for those who need it. So, Madam Chairman, ladies and gentlemen, we believe that doctors should not tell patients who have low-risk cancer conditions that they have cancer, but should instead relabel the condition because... Thank you.
I now call upon the second negative speaker, Imogen Waring.
Good afternoon, Madam Chairman, ladies and gentlemen. The topic for this debate is that doctors should not tell patients who have low-risk conditions that they have cancer. We, the negative team, will persuade you that the statement is false. The affirmative team has defined the topic as that doctors omitting exclusively the word cancer from a diagnosis while ensuring all other information is available. We disagree with this definition as, combined with the widespread awareness of cancer, today's technology has made medical information far too accessible to make the assumption that a patient wouldn't connect the dots with an almost full diagnosis. What would likely ensue would be both a patient's trust in their doctor and knowledge of their condition deteriorating. They had discovered information their doctor had hidden from them and were able to draw conclusions according to their own flawed knowledge in the absence of that from a medical professional. For these reasons, we interpret not telling patients to involve obscuring any information that alludes to cancer, as well as the word itself, from low-risk diagnoses. The second affirmative speaker has tried to tell you that using the word cancer causes patients to opt for more drastic, often unnecessary treatments. This may be true, but, as I will later discuss, only using the word cancer to refer to high-risk conditions will only increase people's misconceptions about cancer, exacerbating the problem, while giving patients accurate information about low-risk cancer will dispel these misconceptions. Our first speaker already spoke about how doctors withholding information from patients about their diagnoses is morally and legally wrong. He also discussed how this would break down the vital trust between doctors and patients. Today I will discuss 3 points. My first point is that not telling patients that they have cancer may impede the doctor's ability to monitor the cancer and prevent it from becoming a serious danger to a patient's health and life in the future. According to Cancer Council Australia Chief Executive Sancha Aranda, while not using the word cancer when communicating with low-risk patients may help to avoid an overdiagnosis and treatment and may help reduce anxiety, it's hard to predict which premalignancies will progress into invasive disease. She said that not using the word cancer when describing these conditions may offer false reassurance to those diagnosed, which could lead to complacency and, ultimately, later diagnosis. Her claim that censoring the word cancer can lead to complacency is backed up by research done by University of Sydney researcher Brooke Nicol. Her research shows that when the label cancer is used to describe a condition, the patients take it a lot more seriously. They would, therefore, be more likely to actively monitor and take preventative steps. While the cancer can start off low risk and slow growing, the rate of its growth can change suddenly. This is because, according to Cancer Research UK, a tumour can't grow much bigger than a pinhead without a blood supply. But once a cancer can stimulate blood vessel growth, it can grow big very rapidly. This shows how important active surveillance is, even in very low-risk cancers. When people aren't told that their condition is cancer, they're lured into a false sense of security, making them less likely to actively monitor and take steps to minimise the risks of their condition. It is far preferable to be told now that you have a very low-risk cancer, be given valid information and be able to monitor and possibly remove it, than to be lured into a false sense of security while the initially low-risk cancer possibly turns into something far worse. My second point is that doctors only using the word cancer to describe serious and life-threatening conditions will only increase the misconceptions about cancer, while giving patients correct information about low-risk cancer will allow people to better understand it and make informed decisions without panicking. According to a study published in the British Journal of Medicine, the problems with telling patients with low-risk conditions that they have cancer began when the word cancer became widely associated with only high-risk cancer. If we start censoring the word cancer in low-risk conditions and only using it to describe high-risk conditions, the misconceptions about cancer will become worse, and people will only panic more when they find out they have it. On the other hand, if we start giving patients the whole truth and explain how low-risk cancers work, people will understand cancer better, will panic less when they find out they have it, will be able to make more informed decisions about possible surgeries, and will have fewer detrimental psychological effects. To summarise this point, it is not censorship, but better understanding of all forms of cancer, including low-risk cancer, that is the best way to eradicate misconceptions and their consequences. My third and final point is that every patient is different and unique, and doctors don't always know what's best for them. While the doctor may have an idea about the patient's condition, they don't know what's best for them. They don't know who the patient really is and what's going on in their life. Because of this, it's not up to them to make possibly life or death decisions on the patient's behalf and gamble with their patient's life. A doctor's job is simply to give patients all the information they need to make their own decisions regarding their body and life. Choosing treatments for cancer is a very personal and complicated decision in which there are many factors to consider, many of which a doctor doesn't know. So the patient is the only person who can make the most informed decision, and they can only do this when information isn't being kept from them by their doctor. So, Madam Chairman, ladies and gentlemen, in conclusion, doctors not giving their patients the full truth is not better for anyone. Thank you.
I call upon the third affirmative speaker, Holly Woolman-Craddock.
Good evening, Madam Chairman, ladies and gentlemen. As you have heard, the topic of tonight's debate is that doctors should not tell patients who have low-risk conditions that they have cancer. We, the affirmative team, strongly believe that this statement is true. Firstly, I'd like to point out the flaws in the opposition's arguments. In terms of our definition for this debate, the negative team stated that doctors would censor and omit information in the sense that the word cancer would not only be left out, but information as to the individual's condition would also be left out. However, this is incorrect because in the link provided on this topic for this debate, it stated that a possibility could be to relabel cancer or word it in a different manner in order to ensure that the patient can still be given a correct diagnosis. However, the word cancer, which can be a trigger word for various psychological impacts, which would be detrimental for the individual, would be taken out. As such, our definition is more effective because it still accommodates for the fact that a patient has a right to understanding their condition. However, it removes the word cancer, which can have significant psychological effects on the individual. The first speaker of the negative team has tried to tell you that individuals are legally entitled to understanding their condition. However, as we explained in our definition by our first speaker, ultimately, we are not arguing that patients should not be told what their condition is. We are simply arguing that cancer should be relabeled in order to ensure that patients are not triggered by the stigmatized social view that cancer is a death sentence, as outlined by bmjopen.bmj.au. Furthermore, in terms of being legally entitled to awareness of the condition, patients could actually further their understanding of the condition because, according to theconversation.com, when patients hear the word cancer, they often stop listening to the rest of the explanation of the condition. So thus, if this word was removed, patients would take more time to understand their condition, therefore actually gaining a better view as to what it is. The first speaker of the negative team also stated that there's a lack of trust established between the doctor and their patients in removing the word cancer. However, in fact, trust would be increased. Ultimately, mental health should be a #1 priority in the case of cancer. Cancer is not limited to physical well-being. There's also emotional well-being. As such, in this case, trust between the doctor and patients could actually increase because ultimately, in removing the word cancer, the doctor is ensuring the psychological well-being of these patients, thus actually establishing trust between them. Furthermore, as our first speaker explained, the doctor would not withhold information. Rather, the condition would be relabeled, thus trust would still remain, and in fact be furthered, as the patient would understand their condition more. The second speaker of the negative team stated that not telling patients that they had cancer would prevent the monitoring of this condition. However, this is incorrect because there have been numerous examples where the name of a disease has been changed, and this has not changed the way that a patient's condition has been monitored. Recently, a reference to cancer was removed from a subtype of papillary thyroid cancer, according to theconversation.com, and the result of this was that not only did patients' anxiety decrease, but they also still maintained adequate treatment and monitoring, according to the evaluation of the study by theconversation.com. Thus, this demonstrates as such that in fact patients would continue to monitor their condition, and furthermore, they would still understand their condition because it would simply be relabeled, so this necessity would remain. Furthermore, in stating that monitoring the condition would decrease through the word cancer being dropped, the negative team is showing the impact of the word cancer on a patient's emotional well-being, because as such, if they believe that one single word can change a patient's state as such, as to how they monitor this condition, then this is evidently harming their psychological well-being. They also stated it would increase cancer misconceptions. However, it would actually decrease misconceptions because it would allow patients to take the time to understand their disease, rather than simply characterising it under a single generalised word, cancer. Finally, they stated that every individual is unique. However, in maintaining the idea that low-risk conditions should not be labelled as cancer, this would recognise this, because ultimately, every individual's mental health would be accommodated for. And ultimately, the treatment of cancer is not limited to physical well-being, but also emotional well-being. In conclusion, we, the affirmative team, strongly believe that doctors should not tell patients who have low-risk conditions that they have cancer. We believe this because psychologically, it would be detrimental for a patient if they heard the word cancer because of its social stigmatisation. Furthermore, it's inadequate to describe the wide varieties of cancer. The word itself can lead to over-treatment, and this over-treatment can lead to further economic expenses, only adding more burdens to these individuals. Ladies and gentlemen, doctors should not tell patients who have low-risk conditions that they have cancer. Thank you.
I call upon the third negative speaker, Madeline Coates.
Good evening, Madam Chairman, ladies and gentlemen. The topic for tonight's debate is that doctors should not tell patients who have low-risk conditions that they have cancer. However, we, the negative team, firmly oppose this statement and will convince you that it is irrefutably incorrect. First, I will rebut the opposition. The opposition has defined the topic as involving omitting no more than the word itself. However, as our second speaker stated, it is feasible that a patient would fill in the gaps themselves, given the accessibility of medical information. This would be a negative outcome for not just patients, but doctors as well, due to the loss of trust. Hence, we interpret the topic to entail patients receiving an incomplete diagnosis that doesn't allude to nor disclose the existence of cancer. The affirmative team has claimed that cancer is not a suitable label for the illness given its connotations and diversity, and patients will experience anxiety that compels them to undergo unnecessary surgeries. However, all of these things can be traced back to one central issue: fear. People are afraid of cancer. Should people not have this fear, cancer would not be an unsuitable term, and patients would neither experience unnecessary anxiety nor undergo unnecessary surgery. But the way to overcome this problem is not to change the name. Cancer, irrespective of the associations to accompany it, is a medical term used to describe a medical condition. If a medical condition is a cancer, then the word shouldn't be censored or substituted purely under the paternalistic presumption that people will react a certain way due to its connotations. As opposed to removing the title and contradicting medical knowledge, we should instead seek to eradicate the fear. Ensuring patients are well educated on cancer and its implications by notifying them of their low-risk diagnoses is a critical part of this process. If people are aware that certain cancers are harmless or treatable, people will no longer have the fears that provoke unnecessary stress or compel them to undergo surgeries that aren't necessary in their recovery. In turn, patients will feel comfortable with their diagnosis and remain alert in case complications arise. Ladies and gentlemen, what we need is not to change the name, but to educate people on what it really represents. And doctors telling patients when they have low-risk cancer is the best way of doing so. To further elaborate, while the first affirmative speaker has claimed that cancer evokes unnecessary stress, anxiety, and other psychological issues among patients, if the doctor does tell them, the patient will also be fully informed and well aware of the low risk of their condition. So, in theory, they have no reason to worry. This is, of course, often not the case due to the misconceptions surrounding cancer. While ensuring a patient is well informed of their condition is a vital step towards eradicating these fears, as I previously mentioned, in the event that the patient does experience psychological effects, these can be managed with appropriate treatment like therapy or medication. Cancer, on the contrary, cannot if the patient has been lulled into a false sense of security and become oblivious to the cancer's progression. Ultimately, it is most important that the patient is aware of their condition, regardless of any stress, so any potential complications can be treated. Additionally, the second affirmative speaker claimed that if patients were aware of their medical condition, they would feel compelled to undergo unnecessary treatment, surgery, medication, or consultation that wastes Australia's healthcare money as well as the patient's own money and takes it away from those who really need it. But who's to say these patients don't need treatment as well? As our first speaker stated, the Australian Charter of Healthcare Rights affirms that patients are entitled to making their own informed decisions regarding treatment. This includes those with low-risk conditions of cancer. If the patient makes the informed decision that they would feel most comfortable using one of the aforementioned resources, it is their right to do so. Australia's healthcare system should not discriminate, but strive to financially accommodate for all who need treatment. We cannot put a price on a patient's rights. Some surgeries may have more disadvantages than advantages, but what the second speaker failed to mention is that when a doctor tells a patient they have cancer, it is also within their responsibility to provide all relevant information regarding treatment to assist in their patient's decision. This includes any possible side effects. Thus, we can conclude that a patient's decision to undergo treatment would be one they are wholly comfortable with. Now, to summarise our team case, our first speaker discussed patients' legal entitlement to awareness of their medical condition and how doctors withholding information would be disregarding these rights along with the patient's autonomy. He also explained the importance of maintaining trust between doctor and patient and the consequences of this trust being disrupted by deception. Our second speaker subsequently discussed the complacency patients may adopt if they aren't informed that their condition is cancerous and the dangers of this prospect. Ensuring patients are well informed, however, renders them more prepared if their condition escalates and helps eradicate misconceptions of cancer, as she also discussed, whereas reserving the word for life-threatening conditions would further ingrain them. Finally, she explained a doctor's role in the patient's life. Being medical professionals, doctors should provide their patients with all relevant information, but it's up to the patient to decide what happens to their own body. So, Madam Chairman, ladies and gentlemen, in conclusion, what we need is not deception, but education. Well-informed patients will ultimately help eradicate misconceptions and replace them with the knowledge that cancer is not always a death sentence, but can also be harmless or manageable with monitoring and treatment. We must aim to remove not the name, but the fear in which cancer is shrouded and bring patients out of the dark. Ensuring doctors tell their patients when they have cancer is a vital step towards this reality. Thank you.